Hello beauties and gents, welcome back to my channel. So in this video, this might be a sensitive subject to you, to most, to some, to all. If you're not interested in talking about breast pain, anything related with women as far as breast issues, mammograms, etc., then you can go ahead and exit out of the video. But in this video, I wanted to talk to you guys about what I went through with my breast pain, what I eventually did, and I wanted to share you guys my results as far as what has been confirmed about what happened and why I was in pain and this and that. So please go ahead and let's keep watching. This is somewhat of a sensitive subject for me as well, you guys, because it's something that I dealt with for almost 3 years. I don't know the exact time frame, but it was like 2 to 3 years that I had breast pain. So I had breast pain. I know that us women get breast pain, they start aching, they start feeling sore, or they start feeling like little shooting needles kind of pain. And that's what I would get, of course, during my menstrual cycles, you know, when I was on my period. Of course, we all know what that's about. So I would get that, but I noticed that also I would get breast pain when I was not on my period. So it was kind of like, okay at first, okay, that's weird. I kind of shoot it off for a little bit, for a few years. So I woke up one night, you guys, and I was in pain. My breasts, like needles coming out. I felt like there was needles in there just shooting at each other, like pew, 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 like just literally pain. So this was maybe like a year and a half into my pain. So I said, you know what? I told my mom, because I confide in my mom a lot, literally about everything. She's all I really have. And she's the only person that I pretty much confide in as far as personal stuff like that. And so I finally told her and I said, Mom, I am in pain. Like, I woke her up and I told her, Mom, please, I don't know what to do. I said, I had never mentioned this to my mom, that I was in pain, you know, with my breasts and stuff. And that was like the first time that I actually had an actual like panic attack with all of the pain I was going through. Before, yeah, it was like pin-like needles, but not so severe to where I had to get up in the middle of the night and be concerned about it. So at the time, I'm trying to remember, I don't think I had insurance, because I remember going to one of the clinics and I had to fill out something, right? And did I have insurance? I don't think I did at the time. I don't think I had insurance at the time. So we had to pull that out. I mean, we had to like we didn't do anything about it. You know, they were like, I'm so sorry, Mom, you don't have insurance, you know. And at the time I was just like with the money thing, and you know, it's very expensive, you know, and I ended up just a whole another year passed. So it was already like going on 3 years that I was like in pain. But that was the only time, like I said, that I was in actual severe pain, was that night that I had woken up. And so I forgot about it for a little while, and then because the pain would come, the pain would go. It wasn't like an everyday thing, but the pain was maybe every like once a week or so, like the mild pain, not the severe pain, because that was the only time I had that pain. So, okay, and so I had been going on 3 years, and I finally told myself, I said, Priscilla, this whole time I was thinking, you know, oh my God, what if I have, you know, breast cancer? Or, you know, these whole few years that I had this pain, I was thinking that in my head. Stuff in your head sticks in your head. That is not healthy at all. Like, my mental health was going down. Like, I was always worrying. What if I have this? What if I have that? And, or what if I don't? And what if I'm fine? And just, I wanted that peace of mind so bad, so bad for those many years. But I was afraid, you know, we're afraid. Us women can be afraid too. I know they say like men are more afraid of women, like we're so strong and stuff like that. Of course we are, but me, I can be weak at times. So I did not want to know anything. I said, you know what, let's just let this pain go. Let's just pretend I don't have it. But in the back of my mind, every day, pretty much almost every day, I was thinking about, what if something is wrong with me? What if I have this and what if I have that? So finally, I think one time I got it, I don't want to say it was like a mental breakdown, because it was just like an anxiety attack from thinking so much. And I said, I can't do this anymore. Like, this anxiety, my breasts hurting off and on, and me thinking I'm not okay. What if I am? What if I'm not? It's just, everything just mixes into your brain, and it's not healthy at all. So I said, you know what? I'm gonna go it was kind of like not a hospital, which it kind of looked like, but it was a big clinic. I'm not gonna tell you guys where I went, of course, but I finally made an appointment, ladies. I made an appointment to get x-rays done to where they can see everything. So I got a sonogram scheduled. So I think the sonogram is not the same as a mammogram, but they said okay, keep in mind, I totally forgot about this. Keep in mind, I go to my gynecologist every year. So what they do is just the regular breast exam where they just touch your breasts all around. And she's always told me you're fine. You know, I don't feel anything. Of course, they can't tell inside what it looks like, but from outside, they can probably tell you something. But yeah, I had been going like to the gynecologist every year, which was once a year. And she goes, ma'am, I don't feel anything, you know, but I was still worried because I had mentioned to her about the pain. And she just kind of said, well, it's probably just stuff you eat and, you know, whatever, wrong size bra, whatever. And then, so yeah, I made the appointment actually my gynecologist made the appointment. But if you think about it, I made the appointment too because I accepted it. I totally told myself, you know what, I'm going to do this. I'm going to find out what's going on. Finally. It was such a relief to actually make that appointment. So of course, I didn't have that done with my gynecologist. I actually had to go to, it was kind of like a center where it was just specifically for x-rays done for, you know, breast x-rays and mammograms and stuff like that. So I went there, and the day of, it was so weird, you know, you're in there with a lot of women, and they're all just in like a nurse's like just like a big robe, you know, so we're all waiting, and it's just very, you know, I was anxious, I was worried, but I knew that I was gonna finally find out what was going on with me, and I was relieved just from knowing I was gonna know already. So before they were gonna do the sonogram on me, they said, you know what, ma'am, we're gonna go ahead and give you a mammogram also. I was so nervous when they told me that. I said, what? You know, like, are you sure? I said, I'm just coming for a sonogram, you know. They go, no, ma'am, you know, if you're saying you're in pain and this and that. They said that they wanted to go even deeper, which was the mammogram. So I said, okay, you know. So I went into the room, and of course it's like a real tall machine, and it's like you put your breast on the tray, so you're like laying it on the tray, and then like it presses in it's kind of like a slide, two slides coming together onto your breast, and then they just squeeze it. And I've heard so many stories about getting mammograms and saying that they're painful, that they're not good for you, that they're, you know, don't do it, or just so many different opinions on that, you know. But I agreed to it, whatever. So I went through that, and it wasn't even painful at all. All you feel, from my experience, I'm not going to say that when you go this is how it's going to feel, because it's all different for all of us, I think. And so it's not painful at all. I did not feel a thing. All I felt was just the pressure that they were squeezing my boob. That, you know, they checked both breasts, by the way. So so that happened. I was done. They said, okay, ma'am, go ahead and wait in the waiting room with all the rest of the ladies that were also wearing the robes as well. And I said, okay. I said, am I going to be getting my results today? Because I know that some people don't get their results in the mail until like a week or so. And they go, oh, we'll let you know. Like, they weren't telling me anything. And that's what was getting me nervous. And I was just like, God, this whole waiting thing was so scary, ladies. It was so scary. But I just knew I was there already. Okay, so after the mammogram, they did the sonogram, which I thought it was going to be reversed. Like, I thought it was going to be the sonogram first and then the mammogram. So they said, okay, ma'am, we just finished your mammogram. We're going to go ahead and give you a sonogram. So I went into another little room, and it was where they laid me down. And it's kind of like when a pregnant mother has to check her baby, where they check the baby. They do that to your breasts. Instead of your stomach, they do it to your breasts. So they're with the jelly all over my breasts. And they were kind of massaging it all over. And they had this little machine that they massage it over onto the oil that they put, or whatever stuff they put. It's like a jelly kind of thing, like a jelly oil kind of thing that they put all over. They were checking, and you can see like literally there, like inside of your breasts, like you could see like the x-ray and everything, like, so it's like see-through. And then so yeah, they didn't say anything. They were just like looking, and it was two ladies, so I guess, like, you know, there always has to be somebody there with them because of what they do. And they go, okay, ma'am, go ahead and wait outside. So he's like, oh my gosh, why does this never end? Like, geez, I was only expecting to go for a sonogram, to be honest. I just wanted to go for a sonogram and then just, that's it. When they ended up saying mammogram too, I was like, oh my gosh, okay, please, just please. And then so I waited for maybe like a good 20 minutes. It wasn't that long. And they finally put me into the same room that they gave me the sonogram in. And they go, okay, ma'am, your results are in. I said, oh my gosh. My results came in that same day that I was there. Same day that they tested me out. So, I was so nervous, ladies. I was like, please, God, please let me at least have some good news. At least, you know, whether it's, even if it's not like, or if it's fixable, if it's, you know, because that's like, you know, it's a big subject. It's a big deal, you know, like checking and, you know, you just talking about it's just pretty much giving me anxiety. Okay, so the results are in. The lady told me, ma'am, you are clear. You don't have anything. She said that the doctor checked the x-rays. He examined them very well and thoroughly. And from everything that we see, everything looks good. We don't see any kind of inflammation or any kind of lumps in there. And I said, oh my gosh, thank you, Jesus. Thank you, Jesus. Thank you, God. Thank you, everybody. Like, I was just like thanking everybody in my head. Like, oh, I was just, my mind was not right at the time because of what I had gone through for so many years with this pain. They go, ma'am, but yeah. I said, well, what could it be? I said, you know, because off and on, I still get this little pain. It's kind of like the pain I described to them was like little shooting pains, like little needles that were inside, like all coming together, like fighting each other. Like, that's just how it felt. And she goes, it could be from caffeine, which I was thinking to myself, I don't really drink a lot of caffeine, but I do drink green tea every morning. And of course, green tea does have caffeine in it. She goes, it could also be the wrong size of bra. If I'm wearing this wrong size of bra, it's gonna give me some kind of pain. She said it could be hormonal. She said it could be anything that I eat that can just inflame it inside. That's just, I guess that's how she kind of, from what I remember, how she told me. And then she goes, but yeah, I mean, I said, so do you recommend me coming back every year or every so many years? Like, what is your suggestion? And then she says, well, we recommend that you come back every 3 years. But then I got this letter and it says to come back every year. So the nurse told me every 3 years, but from this paper that I have here, it's saying to come back every year. So I guess from what the results were for my thing. So keep in mind, I did get the results in paper form, maybe like a week later. So I'm going to read this to you. I'm going to read the results to you guys, and I'm going to tell you exactly what it was. So here we go. It says, we are pleased to inform you that the result of your mammogram performed on the date shown above is negative/benign, not cancer. It is recommended that you return for your routine screening mammogram in 1 year according to the American College of Radiology guidelines. We will send you a reminder letter at the time. The results of this procedure have been sent to your physician and will become part of your medical record at this facility. And then, of course, it tells you, as you know, early detection of cancer is very important. Although mammography is the most accurate method for early detection, not all cancers are found through mammography. A thorough examination includes a combination of mammography, annual physical exam by a physician, and monthly breast self-examinations. So it's a good thing that I go every year to my gynecologist to go get my breast checked, because they feel your breasts and they, you know, as far as I know, they know like what feels normal and what doesn't. And then in the back, it does say what might be the pain. So this is what I'm thinking. So they put, your mammogram report describes your breast composition as scattered fibroglandular tissue, group B. Your breasts are not dense, so the above paragraph does not apply to you. And then up here, it's like a paragraph of, it says, if your mammogram demonstrates that you have dense breast tissue, which could hide abnormalities, and you have other risk factors for breast cancer that have been identified, you might benefit from supplemental screening tests that blah, 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 blah. So ladies, ladies, please. So okay, think about, I'm gonna think about all of the weight I had on my shoulders from not knowing. Okay, so let's say, okay, because I also think about other stuff. That's not the only thing that I've gone through. Let's say I have 4 pounds of bricks on me, or 4 bricks on me. So 1, 2, 3, 4. And this was all the stuff that's I'm holding on to. Literally all this weight I'm holding on to, which is not healthy for your mind, not healthy for your body, not healthy for your overall health, I'm sure. I'm not a doctor, you guys. I'm not a nurse, but from my experience, I'm just telling you guys. And think about it. Like, I got my results. I was so relieved. All this weight, 2 bricks came off. Literally, 2 bricks came off of my shoulders, you ladies. And ladies and gentlemen, because I know gentlemen also, supposedly. I'm not even gonna go there. But please, ladies, like, get your breast check. If you're having pain, it could be nothing. If you're going through pain and you don't want to go to the doctor, or you're scared, don't be scared. Like, I was scared for almost 3 years, and it messed with my mind so bad. So I recommend, ladies, please just go get done what you have to get done. It's such a weight off of your shoulders, off of your mind. Your overall health is just gonna be so much better. Those bricks are gonna come off your shoulders like nothing. Like, it's knowing the results. And I'm not saying, oh, I'm gonna be healthy like for the rest of my days. I'm gonna go back every year. I'm gonna keep going and keep getting this done, because this is what's going to keep my mind sane, knowing that I'm okay for the year, you know. And speaking of this, I'm actually probably due, when did I get this done? Okay, January, February, March, April, May, June. So I'm due in a few months, actually. So we're gonna be in February. Yeah, so I'm already due like in the summertime to go back so they can check them again. And I'm gonna go. I'm gonna make that appointment. So do it. Thank you, ladies, so much for watching. I appreciate you. Thank you, ladies and gents. I appreciate you watching this video. Like I said, if you are concerned, just go get it done. Go get that done, and you will feel a lot better, I promise you. And thank you guys so much for watching, and I will talk to you guys later. Bye.